All right, hello everyone. So this video is going to be for the part one of chapter 10 in your pharmacy practice for technicians book. Chapter 10 is on extemporaneous non-sterile compounding. So compounding is a process of preparing medications from bulk ingredients according to the prescription from a licensed prescriber. So it's important to understand that every prescription, even if it is being made in a specialty compounding pharmacy for an individual patient or even an animal, does require a prescription from either a prescriber or a veterinarian. So there's different situations that could warrant a prescription for a compounded product. One of those is for a dose for a pediatric patient that is smaller than what is commercially available. So what do we mean by commercially available? So commercially available is the product or the dose or the drug is manufactured by a big drug company and it is sent to the pharmacy. So, usually most of these are specific to adult dosages. There are pediatric formulations for the common medication like antibiotics and things like that, but sometimes we have a pediatric patient that has different types of health conditions that needs a adult medication but put into a pediatric dose. So an example would be preparing 10 milligram capsules from 30 milligram capsules. So we have the 30 milligram capsules already done by the manufacturer. We're going to recompound those down into 10 milligram tablets. Another reason is patients cannot swallow a solid dosage form. So sometimes patients have medical conditions or diseases that make it hard or unable for them to swallow solid dosage forms. So then we can actually prepare in a suspension from the tablets. Dose for veterinary application that is not commercially available. So that's probably, we have a couple little mom and pop compounding pharmacies here in town. There's a couple, spread out throughout the town of Tucson. And the bulk of their patients are actually veterinarian patients or animals. And so the reason for that is a lot of animals, let's take dogs and cats, for example. So dogs can get valley fever just like humans can, but valley fever is a little bit more dangerous for animals, particularly dogs, because where in humans it kind of stays within the lungs. And we have kind of mild cold symptoms from that. If you've lived in Arizona for a long period of time, you've already had valley fever. But with the animals and dogs in particular, it does spread throughout their body. It can go to their brain and into their bones and their organs. And so they need antifungal medications. Now, these antifungal medications come in dosage forms for humans, but they have to be compounded into dosages for animals. And they do a really good job of compounding those into little tasty treats. They call them chewies, flavored suspensions like beef and chicken, tuna for cats. So they take the medications that they can't get in the dose that the animal needs, and they prescribe it through the veterinarian, send it to the compounding pharmacy, and the compounding pharmacy makes it into a tasty, hopefully tasty and easier to give formulation. So another example would be preparing like a thyroid medication for a cat. Sometimes the medication just has an unpleasant taste. So the compounding pharmacy can prepare a flavor masking syrup that can be, compounded into the drug, especially for peds patients. They're not very compliant if it doesn't taste very good. And then let's say if an oral medication has an adverse effect, or it causes an adverse effect or even some really serious side effects, the patient needs the medication, but they can't get over the side effects that are happening. Most medications can be turned into let's say a gel or a cream for the patient to use topically, and be able to allow them to take it that way. So there's two types of compounding. Sterile compounding, which uses aseptic technique to prepare solutions free of microbials or microorganisms. So every sterile compound, whether it's an IV or an eye drop or anything that needs to be prepared in a sterile environment, will be done so in typically hospitals, in some compounding pharmacies, long-term care, anywhere where they're going to have a clean room and an IV room specific for preparing those in a sterile environment. Medications that are considered non-sterile or not, compounding would be things that do not need to be prepared in a clean room. So if we're making suspensions or creams or ointments, suppositories, those type of things, we don't have to compound those in a clean room. They can be done in, it still has to be a sterile environment, a clean environment, but it doesn't have to be specifically done in an IV or a clean room. You will use guidelines to keep the medications free from contaminants as possible, and only allowed for medications and dosage forms that are not commercially available. So there is a law that requires any compounded medication must not be commercially available. That means the dose or the strength or the route that is being compounded is not already pre-made and distributed by a manufacturer. So typically extemporaneous prepared for a specific prescription for a specific patient. So every compounding pharmacy makes prescriptions. These are specific to the patient's needs. A lot of patients are hospice patients because a lot of patients that are in hospice have difficulty swallowing tablets or capsules. Again, veterinarian medication because they can do alterations for different sizes and breeds of animals. And there is a guide for veterinarian prescription drugs, and so the compounding pharmacies have to follow suit with that as well. So there's 3 levels of complexity when you're doing non-sterile compounding. You have simple, moderate, and complex. So simple would be reconstituting and combining commercial products following the USP monograph instructions, and there's really no known, unknown calculations that need to go into that. So let's say you have a powdered bottle of amoxicillin. You have to add 120 mLs of water to make it a suspension. Boom, you're done. Okay. Moderate requires some special calculations. So in the event of you have to figure out, how many grams you need of a certain drug to add to an ointment base to make a ointment. And then complex means that it requires special calculations, decision-making process, so critical thinking is huge. You have specific set of procedures, equipment, and environment. So a lot of times this is the complex is not just for non-sterile but also for sterile compounding as well. So complex would be you're trying to determine how many capsules of a 10 milligram that you can pull from a bottle of 30 milligrams. So it's just more intense calculations. So the Food and Drug Administration Modernization Act of 1997 allows pharmacists to compound non-sterile and or sterile medications for patients if medications do meet the USP standards. So USP is United States Pharmacopoeia, and they set the standards and the guidelines for non-sterile compounding, sterile compounding, and actually compounding of hazardous products. All individual state board of pharmacies oversee local compounding pharmacies within their state. And then there's other professional organizations that work with the state boards to ensure the compounding quality and safety. So again, USP, you have the International Association of Compounding Pharmacies, ASHP. So there's a lot of different organizations. So in 1997, when the Modernization Act was passed, compounding commercially available products was prohibited. So this goes back to compounding pharmacies are only allowed to compound things that are not readily available for dispensing in a retail pharmacy. Compounding pharmacies are not required to follow good manufacturing practices, adhere to product labeling, or submit for drug approval applications. And that's one of the exceptions that they made in this particular act. If a community pharmacy sells to healthcare professionals or out-of-state pharmacy, then they must apply for a manufacturing license. So let's say that they make a bulk special gel that they use for ultrasounds that have a particular medication in it because they're using it for some type of physical therapy. If they're mass producing it and selling it to healthcare providers, then that compounding pharmacy must apply for a manufacturing license. The same thing is if you have an out-of-state pharmacy that contacts your local compounding pharmacy to have you compound things for them, it's illegal unless you have a manufacturing license. So accreditation for compounding pharmacies provides a competitive edge within the marketplace. So think about this. If you were going to choose between one compounding pharmacy and the other, would you rather go to one that has been accredited through different organizations or one that hasn't bothered? For me personally, I'd rather go to the ones that have been accredited because that's a voluntary process. So they have voluntarily decided to go through the accreditation process to show that they're meeting the standards of the industry and compounding and all of that. The pharmacy must agree to meet all standards for both sterile and non-sterile compounding if they're going through the accreditation process. This includes a monthly or quarterly spot check. So what they have to do is they're going to randomly send out products for testing in an outside lab. So let's say that I am a technician and I have just made 35 capsules of an estrogen bioidentical hormone for a female patient. I have 5 extra. They're going to send those 5 off to a lab to be analyzed to make sure that I'm compounding correctly. So the product is allowed to have a plus or minus 2% of potency, 2% above, 2% below. Anything above that or below that, then I'm going to be retrained, okay? Any corrective action must be documented and dated by the pharmacist. So let's say mine came back out of range. The pharmacist is going to document that. They're going to document my retraining, and then I'm going to prepare another batch that is going to again be sent off. Compounding pharmacies must have continued quality improvement or CQI processes to identify and resolve any problems. So they're required from these accrediting bodies to have these continued quality improvement processes in place, because we don't want technicians and pharmacists to get too complacent. You know, if you've been doing something for a very, very long time, it's important that these samples are being sent off, because you want to make sure that your staff is being trained properly, and that after their training, even years down the road, they're still following the correct policies and procedures and recipes when it comes to compounding. So USP Chapter 795. So USP, again, is United States Pharmacopoeia. Their standards were developed to enhance patient safety for non-sterile compounded products. That is particular for USP 795. So USP 795 sets the standards for non-sterile compounding. Compounding pharmacies must also follow good compounding practices, which is GCPs. And if you're looking at slide 14, it breaks down the different chapters of USP. So USP Chapter 795 is specific to non-sterile compounding only. USP Chapter 797 is specific to sterile compounding only. And USP Chapter 800 is for the preparation of hazardous drugs, so things like chemotherapy. So there's different components of good compounding practices. So the first one is the facility. The facility must have designated areas or space that are separate for sterile compounding. Your personnel must be staffed with education, training, proficiency in sterile compounding, also proficiency in non-sterile compounding, and they must also wear protective clothing. Your equipment within a facility must be of appropriate design and size, space of the balancing and measuring devices, and everything must be cleaned and calibrated before you use it. Ingredient selection, so only high grade chemicals and are required for use. And again, proper storage and use of those drugs is required, or ingredients. The compounding process, so each step is reviewed by the pharmacist plus the final check. So that's different than a retail pharmacy. The retail pharmacy, the technician is going through all of the motions until the very end when the pharmacist presents the final check. But in a compounding pharmacy, the pharmacist is checking each step along the way. So when a technician weighs one ingredient, they check it. When they weigh the other ingredient, they check it. When they mix it together, they check it. So all the way through, there's a pharmacist checking every step and then still provides the final check at the end. So packaging and storage, all ingredients, containers must be properly labeled. Quality controlled programs are run by the pharmacist. Labeling of excess products. So let's say you have you've made excess powder for a particular compound. You want to make sure that you have labels that show the quantity and then the lot number that's assigned. Beyond use dating is used to show the stability and sterility of the drug, reflecting the dating. So if we have taken something from its original existence, okay, if we've taken a tablet and made it into a suspension, that expiration date of that tablet is no longer valid. You have to use beyond dating. Typically it's 60 days for most compounded things, but you will work with your pharmacist if you're working in a compounding pharmacy. They have all of those dates set for specific items. Some things are better, good longer, and some things are only good for a short period of time. Records and reports, so your master formulation record, the compounding record, your equipment maintenance records, all ingredient logs and records, all of that is kept within the pharmacy. Patient counseling is also part of that, so discussion with a patient on the administration of the drug and then the storage of the drug. So remember that the patient counseling can only come from the pharmacist. Technicians are not allowed to do any counseling. So your duties for compounding under the supervision of a pharmacist can include retrieving recipes, gathering ingredients, calibrating your equipment, weighing and measuring and mixing, preparing, checking and ordering inventory, assigning beyond use dating, printing and affixing your labels to your prescription bottles, and then keeping your workspace clean. So it's important that you as a pharmacy technician, no matter what setting you're working in, if you're working in a hospital, retail, long-term care, mail order pharmacy, compounding pharmacy, that you're cleaning your space in between each fill. Most in particular between compounding. So you don't want to risk any cross-contamination of drugs. So certification of pharmacy technician. So you're going to pass a national exam. In the state of Arizona, you all have either applied for or have already received your Arizona Tech and Trainee license. That is only for 3 years in the state of Arizona. So once you finish your schooling and you get close to externship, we're going to have you schedule your national exam. When you pass that, you then can apply for a certified pharmacy technician license. That you'll renew every 1 to 2 years, depending on what month you apply. But the important thing to understand is that you're going to eventually have to take this exam. You will not be able to work on that trainee license after it expires in 3 years. They don't let you renew it. You'll practice with calculations and compounding skills. Now, the hands-on portion to this course obviously cannot be done online, and that will be done once we're approved to go back on ground. Mini certificates or certifications in lab training for non-sterile and sterile compounding. So the Professional Centers, Compounding Centers of America, or PCCA, they offer workshops and additional labs that you can do. If you go into work for a compounding pharmacy, usually your place of employment will pay for this additional training. Additional training is required for compounding with hazardous substances. The USP standards regarding education of personnel and training is ongoing and re-evaluated annually. So no matter where you go, you're going to continue to be re-evaluated annually. That's your annual, right? Where you can get a raise, where you may not get a raise, but that's your time where your supervisor is going to call you in and say, hey, this is what's going really well. These are the areas you can improve on, and make sure that you take that both good and bad. And it's not that it's bad, it's just constructive criticism. You want to be told if you're not doing something correctly, because that could mean the difference between someone's life and someone's death. So we're going to go ahead and stop there. So you do have a daily assignment for chapter 10 to go ahead and do that. We'll continue on with the next part, and have a good day.